Well, good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Thursday, July 2nd, 2020. Joining us today, Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen de Villa. Mayor Tory.
Brad, thank you and good afternoon. I hope that residents all had a good Canada Day and were able to celebrate our great country virtually or in small gatherings with friends and family. This year's Canada Day celebrations were, of course, very different, but I'm encouraged by the commitment and resiliency of our residents who came through yesterday to show pride for our country, especially street to street and neighborhood to neighborhood, celebrations which were yet another example of how we've come together despite this pandemic. And I want to say a special word of thanks to the CN Tower who put on that wonderful light show last night. We know that many people watched it online from the measurements we've been able to do, but also there were many people watching it in parks and across the city, and we appreciate their efforts in that regard. Today is an important day because it marks the start of mandatory face coverings on the TTC. This morning I was at Kennedy Station with the CEO of the TTC, Rick Leary, and with Deputy Mayor Michael Thompson and Councillor Gary Crawford, and we were there to hand out some of the 1 million masks the TTC is providing to riders and to help reinforce the message that masks will be required starting today when riding our transit system. I was encouraged by day one at the number of people who were wearing masks, who we met, but there's still work to be done raising awareness and ensuring compliance with this important health and confidence building measure. There are, of course, exemptions that have been made for children under 2 and anyone with health complications. But we're asking people to please wear masks, face coverings on the TTC so that we can all continue to have a safe and comfortable experience on transit and keep each other healthy. It's about everyone protecting and respecting each other. And more importantly, it is about stopping the spread of COVID-19. As you know, City Council just approved a recommendation from our Medical Officer of Health, Dr. Eileen de Villa, that calls for mandatory masks in businesses and enclosed spaces that are open to the public. This comes into effect next Tuesday, but there's no reason not to start now. We do not want to see a resurgence of this virus in Toronto, and that is why we are doing everything we can as a city, as we have done throughout the pandemic, so as to stop the spread of COVID-19. As we have done throughout, we have not been afraid to act on the advice of our health experts, and we will continue to do what is right whenever it is recommended. Thank you to those who've already been wearing face coverings and to those who already follow the bylaw. Now, July also marks the start of Caribbean Carnival Month. I'm proud to proclaim this month again this year in the City of Toronto. Normally, we would be gathering perhaps even this week at Nathan Phillips Square to announce the festivities for Toronto Caribbean Carnival with lively song and dance and music. But regrettably, that is not possible this year. Things are different, but that doesn't mean we should lose sight of one of our most treasured summer events. In years past, this event has brought 1.3 million people to Toronto from around the world and from around Southern Ontario. The event has a huge impact on our city's economy. To continue the tradition, organizers at the Toronto Caribbean Carnival have put together a celebration with virtual events during the month of July. I encourage residents to celebrate the rich Caribbean culture that is present here in the City of Toronto and to partake in the various events that are happening this month. And for more information on these events, please visit torontocarnival.ca. Today, the province announced some very encouraging news: an additional $150 million in funding province-wide for improving homeless shelters and creating opportunities for longer-term housing. This important funding, which will flow through the Social Services Relief Program, will help cities with new costs related to COVID-19 changes and will help us protect our most vulnerable residents as we continue to respond to the pandemic. Our most vulnerable populations have been our #1 priority during the course of the pandemic. Today's announcement is a clear indication that the province is listening to municipalities and wants to work with us in addressing the financial impacts we are enduring as a result of COVID-19. It would be made even more effective if we could be assured that the federal government will match this kind of assistance pursuant to the requests we have made to both governments. This is just the start, and we know there is more work to be done. And I look forward to working with the province not only on Toronto's share of this new funding that was announced today, but also on future financial help for cities from both the federal and provincial governments. During the fight against COVID-19, we have been steadfast in our response, and we have not been able to do this on our own. We've managed to get to this point thanks to the important work of our frontline workers. I've seen window signs, messages of love on social media, witnessed many acts of support by neighborhoods to bang pots, to sing, to get out in the streets, to have car cavalcades, and all kinds of other things. All of this has been in recognition of our frontline service providers, our neighbors, our heroes, who continue to fight and to work on the front lines and have been doing so now for several months. Some of these heroes we are talking about here, and this is by no means an exhaustive list, are our healthcare workers, first responders, volunteers, grocery and pharmacy workers, and delivery service workers who are actively working to keep people supported and to help us keep people healthy from COVID-19. So now is the time to honor their hard work and their dedication to our city and to its residents. In May, there was a call to local artists by the city's Street Art Toronto team for a new graffiti art mural project called the Start Frontline Heroes Art Project. This project empowered 23 of our own street mural and graffiti artists to create 15 street art wall murals comprised of diverse frontline service providers of all ages, genders, backgrounds, and professions. The call to the artists closed at the end of May, and an advisory panel selected a roster of artists to receive up to $3,000 to help fund their creation. This initiative was made possible through funding that was provided to the city and START from private sector partners. I want to thank those partners for believing in these artists and for making this project possible. It's another example of how we all have come together to help and support those who need it, and that has included not just the frontline workers, not just the patients, but also the artists themselves who've gone through a very tough time. This funding will help us to honor our frontline workers who have played a vital role in our fight against COVID-19, and I'm very pleased to say that some of these mural projects have already been completed and more will get underway this month so that people can actually start to enjoy this beautiful art. These works of art represent a legacy piece that will celebrate those who've stepped forward and put themselves and their families at risk to the virus to help all of us. And while words won't ever be enough for us to show our gratitude, these murals will be a lasting reminder of a time when we needed heroes and when we found them right here in our community from among these frontline workers. So thank you to the street artists, thank you to those who are celebrated in these murals, thank you to the donors, and I hope that you'll take advantage of going to see this art as it is made available with details to be found at toronto.ca. As you know, the city has been conducting a survey online to get opinions and thoughts and ideas from residents and businesses about how the city can best recover and rebuild from COVID-19. I want to thank everyone who's taken the time to provide us with their feedback. There have been some 10,000 of you so far, many in just the past week. And given the number of people who responded in the last few days to make up that 10,000, we're extending the deadline to July 15th so that we can get even more people to participate in this survey about how we can best rebuild and recover our city. It's important for us to get as much feedback as possible, so I invite you to join in by going to toronto.ca/recoveryrebuild to complete this survey. Finally, before I finish, I want to end off with some other good news. Oftentimes, in periods of crisis, good news developments in the city go relatively unnoticed. On Friday, I chaired a meeting of the city's somewhat obscure but very important debenture committee, at which time the city's first ever social bond was formally approved. The debenture committee exists to formally approve the city's borrowing so that we can make sure that there is public accountability for that borrowing, which of course goes to finance a lot of our capital projects. Toronto is the first government in Canada to establish a social debenture program, furthering its leadership in sustainable finance and promoting positive and equitable socioeconomic outcomes. Proceeds from this bond will be used for specific projects which advance some of the city's social policy goals. So in this case, some of the proceeds will be used, $100 million of proceeds. Some of that will be used to finance part of the George Street Revitalization Project. It is a very significant new facility to support homeless, marginalized, and elderly city residents and for new shelter facilities, including 1,000 new shelter beds. The bond issue was 4 times oversubscribed. In other words, there were people who wanted to buy 4 times as many bonds as were available, and it achieved the lowest ever borrowing cost for the city at 1.602%. The Chief Financial Officer for the city reported to the Debenture Committee at our meeting last week that the success of this social bond issue reflected not only its appeal to investors who are looking for projects with various sustainability attributes, but also acknowledged the confidence they have in the City of Toronto and the way in which we're managing its affairs. This is another testament to the strength of our city's economy and the confidence people have in us and the way we're managing the city's affairs. And that is why it is so important to get through the pandemic successfully and on a sustained basis so that we can get back to recovery and to rebuilding and back to the success we were enjoying when the pandemic came along. This will take effort from every single one of us, as we have said repeatedly since we started talking about this much earlier in the year. So thank you very much for helping us get to this point. Thank you for your anticipated cooperation with the rules that we're bringing forward with regard to the wearing of face coverings. This will make a difference in protecting others from you, and if they cooperate as well, it will protect you from others in terms of the spread of this virus. I'd like to ask Dr. de Villa now to present her report for today.
Thank you, Mayor Tory, and good afternoon. Today, there are 77 new COVID-19 infections in Toronto. To date, 12,574 people have recovered, an increase of 71 since yesterday. I continue to be encouraged by the steady decrease in cases in our city. This is a direct result of our collective hard work. As always, for more data on the status of COVID-19 cases in our city, I encourage you to visit our website. Earlier today, we held our 3rd virtual Board of Health meeting, where I provided an update on our COVID-19 response and recovery efforts. As part of this presentation, I shared some updates to our interactive map of COVID-19 cases by neighborhood and high-level socio-demographic data that indicate that some areas of Toronto have higher rates of COVID-19 than others. This includes some areas in the northwest corner of our city. However, it is important to note that every single area of our city has been impacted by COVID-19. The map is a useful tool to inform our strategy to protect your health and helps us determine when and where we need to adjust our actions as we continue safely reopening our city. My presentation is now available on our website. My update to the board also included findings from a review of how social determinants of health seem to be affecting COVID-19 infection and outcomes. Specifically, our analysis found that areas in the city with the lowest income levels reported higher COVID-19 infections and more hospitalizations compared to areas with the highest income levels. Areas in the city with the highest percentage of newcomers reported higher COVID-19 infections, and areas in the city with the highest proportion of people living in overcrowded housing reported higher COVID-19 infections. This is not surprising, as we know that the virus spreads through close contact with someone who is infected. My team will use these findings to track COVID-19 trends across our city and inform future public health actions and community engagement to reduce the impact of COVID-19 in Toronto. I also provided an update to the board on our COVID-19 monitoring dashboard, which shows that our overall status continues to be yellow, with 2 of 4 categories of indicators showing a green status and 2 showing yellow status. There has been an increase in the acute care bed occupancy rates, prompting us to change this particular indicator to red and the overall health system capacity category to yellow. This is not surprising, given that hospitals are now ramping up activity and taking on elective procedures. We will continue to monitor this category of indicators along with our healthcare partners. A very slight uptick in new cases at the end of June has led us to keep our new cases of COVID-19 indicator at yellow. However, we are continuing to see a general decline in new COVID-19 case counts, and this is good news. As the outbreak continues, we will see fluctuations like these from time to time. It is important to remember that at this point in our outbreak story, it is more valuable to focus on the general trends and patterns, including new hospitalizations and not necessarily daily changes, which are less significant at this point. As a result, next week, we will be moving to update our COVID-19 dashboard and daily case press numbers 3 times a week on Mondays, Wednesdays, and Fridays. This will allow my team the time they need to focus on digging deeper into our data, which is important to help us better understand COVID-19 trends as we move through the outbreak and prepare for a potential future wave in the fall. It is now just over a week since we moved into stage 2 of reopening. Since this time, I have certainly noticed more smiles and an increase in energy in our city as more people move around the city. Entering this stage is a significant milestone for us, and it took a great deal of work and sacrifice for us to get to this point. But while our COVID-19 case numbers have decreased, the virus continues to circulate in our city. We are still living with COVID-19, so please continue to be careful. We must not take the progress we've made for granted. We need to keep moving forward with care. For this reason, on June the 30th, I asked City Council to require masks or face coverings in all enclosed public spaces. I was very pleased that City Council voted unanimously in favor of this requirement, which will be in effect as of July the 7th. This action will help us to reduce the spread of COVID-19 and protect our health. Remember, I wear my mask to protect you, and you wear yours to protect me. Finally, since the start of this pandemic, I have asked you to take care of each other. With this in mind, as you get outside to enjoy the fresh air and the nice weather, please continue to keep your distance from others outside of your social circle. Please keep washing your hands, and please keep taking care of each other by wearing your cloth mask or face covering when you are in enclosed public settings. Thank you, and I'll now turn it over to Brad.
Thank you, Dr. de Villa. Before we go to questions, reporters on the line, just so you know, we have Mary Ann Bedard from Shelter Support and Housing and Paul Raftis from Senior Services and Long-Term Care, should you have questions on those specific topics. We go first to Paula Lorigio from the Canadian Press. Paula?
Hi, I'm hoping you can hear me. I've been having some audio issues. So
we can hear you fine. Yep, go ahead.
Okay, great. It's just been announced that Toronto will be one of the NHL hubs, and that a fairly large part of the city, including Exhibition Place, will be used to house staff, players, and so on. And that area will be closed off largely to other people. Given that that kind of outdoor space is being used currently to provide healthy activity to residents, are you concerned at all about closing off that kind of public space for residents to use during the pandemic?
Well, first of all, if indeed it has been announced, I am delighted. that Toronto has been chosen as one of the hubs. We worked closely with the other governments and with MLAC, Maple Leaf Sports and Entertainment, to try and get this wonderful attraction here to our city, where I can't be biased as the host city, I guess, but on the other hand, I think it'd be great to see the Toronto Maple Leafs win the Stanley Cup right here at home. So we'll see how all that unfolds. With respect to the question of public space, we take the availability of public space to the public at large very seriously, as evidenced by the fact that we have created the quiet streets, we've created active TO, and other things that we've done in order to make sure that is the case. I suspect that this will have a minimal impact on that, but if it's proven that there's any impact on the public's use of those kinds of spaces because of the presence in Toronto of the hockey players and all the other hockey teams, we will take appropriate action to make sure that there is adequate public space available within the context of physical distancing for the people of Toronto, so that we can have our cake and eat it too. Have the NHL resume its season here, and I thank them for the confidence they've placed in Toronto, and make sure that the residents of the city can have adequate access to important outdoor public space during these summer months.
As a separate question, we're looking at you were talking this morning about the TTC mask requirement and how the city will then adopt a similar requirement as of next week. Do the same exemptions and kind of penalties apply? Is there, for now, the TTC aspect looks like there's not so much emphasis on enforcement. Will it be the same at the city level?
Did you catch the last part?
No, I'm
if you could just
sorry,
repeat
Brad.
the last
I
sentence.
think it was just on
TTC
enforcement.
aspects.
Paolo, can you repeat that?
Yeah, sure. In the discussions about the mask requirement for the TTC, so far the messaging has been that the emphasis will not be on enforcement. Is that the same for the requirement at the city level? And if not, well, what will be the penalties?
So perhaps I can take that question first. As with every bylaw and as with every aspect of that which has been involved in this response, the focus is on education and encouraging people to adopt the right behaviors rather than enforcement. And my understanding is that with the mask bylaw, there is an application process that is required in order to get fines, and that process has been started. So I don't have specific details on that, but I would emphasize that the point is really on ensuring that policies are in place within those indoor public settings to actually encourage and foster the likelihood that people will be wearing masks, because it's the right thing to do. We know that people around the City of Toronto have stepped up and done the right thing when asked to do that. We're hoping that whether we're talking about businesses, facilities, owners and operators of public spaces, enclosed public spaces, or members of the public, that they will all step up, wear their cloth mask and face covering when they're in those enclosed public spaces, because we wish to protect each other and we wish to get our city back sooner rather than later.
May I just add to that? I saw this morning when I was out on the transit system that many people have already begun to wear these masks on day one before there could be a huge level of awareness about it. And that's because they heard about it, they heard the advice, which was previously strongly recommending that they should wear a face covering. And if you think about it for a minute, of all the laws we have that try to govern behavior that is going to be in the best interest of a healthy, safe society, it isn't possible for us ever to have enough bylaw inspectors or police officers or anybody else being on every street corner and every store or every transit vehicle all the time. We rely in Toronto on people doing the right thing, on people deciding it's really important to protect each other and our health and stop us from sliding backwards on this. And so I think the reason they've had 90+% compliance in other cities is because people recognize that is something they can do for the betterment of themselves and their city, and that's what they'll do here without us having to go around and engage in a lot of enforcement efforts.
Okay, thank you. Next, we go to Alice Hopton from CBC. Alice?
Hi there. My question's for Dr. de Villa, and it's about the demographic data you were presented this morning about COVID-19 at the Board of Health meeting. What did you find more striking about that data, and what is the city going to do to address it? Thank you.
So thank you for the question. I think that when we look at those data, we had some suspicions, and we know that those who have challenges in respect of accessing the various social determinants of health tend to have worse health status and suffer health inequities relative to those who have higher income, who have higher levels of education. and who are better housed, just to name a few of the social determinants of health. I think we wanted to make sure that our suspicions were borne out in the data, and it certainly helps us determine how best we proceed, what sorts of strategies, what sorts of initiatives we can put into place. So one of the initiatives that was specifically discussed at this morning's Board of Health meeting was the notion of supporting isolation facilities for those who have very specific challenges in effecting a safe and effective isolation should they become ill with COVID-19 themselves. I've talked a little bit about in my remarks today about how there are some people who live in crowded housing situations, and achieving a good isolation from others in the household is challenging in those circumstances. Hence, we're interested in pursuing voluntary isolation facilities to help individuals in those circumstances achieve a safe and effective isolation. But I think there are a number of issues that are at play that will require further follow-up, and they are not new, really, to the realm of public health. Having better, affordable, more sustainable housing, issues around income supports. These are the kinds of things that we've been talking about in the realm of public health for a very, very long time in terms of affecting the social determinants of health, so that we all enjoy better health, both those who would benefit directly from them, but as well as a society. We know that when the inequities are smaller, when they're reduced, that actually the entire society benefits. So I think those are some of the things that we were talking about at today's Board of Health, and that you can expect us to talk about in the future.
Great, thank you. Just to follow up, we saw a busy weekend at the Toronto Island. So what do you say to some residents there who might be concerned about the elderly residents who live there, about how many visitors are being allowed to go to the island with the ferry reopening?
So from a public health perspective, we know that the risk of virus transmission in outdoor settings is significantly reduced compared to that which we see in indoor settings. So we certainly want people to take advantage of the public spaces, public outdoor spaces in particular in the city. It is summer. We know that summer is all too fleeting in our city and in this part of the world. So we certainly encourage people to go out and enjoy that space, knowing and having some reassurance that virus transmission is significantly reduced within those outdoor settings. With respect to those who are older, we would recommend that, trying to keep that physical distance continues to be important, even in the outdoor settings. And I would ask those who are visiting our public spaces, whether it's the island or any of our parks, to try to respect that physical distancing, the hand washing, and staying home when you're sick. That, along with using a cloth mask or a face covering for those circumstances where that physical distance cannot be maintained, would be the mainstays of protection. But I would encourage people to get outside, enjoy some physical activity, enjoy the nice weather while it's here, but to try to do so in a way that protects others and best promotes good health in our community.
Okay, thank you. We go next to Jennifer Pagliaro from the Toronto Star. Jen, go ahead, please.
Fred, I wanted to ask Marianne, who I believe is on the line, about the announcement Premier Ford made earlier for funding to help municipalities with homelessness services. I know he was asked about that not being very much overall in terms of Toronto alone having such a great need. I just wonder if there's any sense of what cut of that money the city will be getting and what it will be used for.
Thank you for the question, Jennifer. I mean, I certainly greet the announcement today as really good news. The province has been a good partner with us so far. When they announced the emergency fund earlier in March, they did indicate that it was a sort of a down payment on more money to come. So we were significantly pleased to see this announcement today. I don't know the exact allocation that Toronto will receive. I do know that they are trying to focus on areas of the province that have experienced significant impacts from COVID. and also places in the province that have significant issues with homelessness. So I am encouraged with those two priority areas that Toronto will receive a significant portion of that funding. And I look forward to the partnership with the province to make sure that we are using that money to achieve some long-term objectives that help us focus on housing.
May I just add a word to that and say this? First of all, it's an application-based process, and I believe that we have a significant enough problem here that is recognized relative to anywhere else in the rest of the province that we are in a position to put in applications. We have the resources to make sure we can have good applications that meet the test and thereby get a significant share of this money. But as I said earlier on, it is going to be magnified in terms of its effectiveness several times over if it can be matched up with equivalent funding with equivalent criteria that comes from the federal government. And so this is part of the broader ask for support from the other governments, which is to help us with the extraordinary costs that we have incurred in looking after our most vulnerable populations. And I hope that we will find that this money is matched either through existing programs or new initiatives that are put forward by the federal government, so we can have twice as much money, as it were, or even more than that, to work with based on the size of the need we have right here in the City of Toronto.
Can I ask a follow-up on a different subject? I'm not sure if staff is there to elaborate, but I'm wondering how Cafe TO went yesterday and if there's any sense of how many businesses can now operate that way.
I don't know if there's any staff on the line. I don't believe I heard Brad say there was, but I can say this because I was out visiting one of the sites yesterday, one of the first, and to say that there had been more than 400 approved applications, with more applications still pending, and we're trying to work through them as quickly as we can. Certainly I can say, without trying to put words in his mouth, the operator of the one place we were at yesterday was happy that this had been put in place in record time. And I know a number of the others were also able to be open yesterday, but we think the response to this is indicative of the fact that it is most welcome news. Although the proprietor I spoke with yesterday, similar to many others I've spoken with over the last couple of weeks since we went into stage 2, have clearly indicated, as we understand, that while this helps, and it was something the City of Toronto was able to do expeditiously and with a minimum of fuss, it is not going to make these into viable businesses. We're going to have to be able to get our numbers right and move to stage 3 and assume that contemplates some opening up of indoor dining in order to have this industry even have a chance to see a future for itself in the context of 2020.
Okay, thank you. Next, we'll move to Jane Stevenson from the Toronto Sun. Jane?
Oh, hi, this is Mayor. I was just wondering if you knew if any fines were issued today for people not wearing masks on the TTC, and if not, do you feel like you're in that 90% and above percentage of people complying?
I would not venture to say that we would be at 90% yet, because I think there were people I ran across this morning and handing out the masks that didn't even know as yet that the rule on the TTC came into effect today. And that's why we've got a robust program of public communication in, I think, 10 or 12 different languages across every media platform you could imagine to make sure people understand what the rule is and why face coverings are important. I would be surprised if they issued any tickets today, because the approach that has been recommended to them by the people that they work with is one of education for people, similar to what we were doing today, handing out masks, and the TTC staff will continue to do that in the coming days, because we have 1 million of those masks to hand out, and I think they serve as a powerful reminder of what the new rules are. I will say this. I was very heartened, being admittedly at only one subway station, but I was also watching at bus stops along Eglinton today, that many, many people are already in sync with this regulation to wear a face covering, and I think those numbers will only rise in the days ahead as awareness increases.
Can I have a follow-up on a completely different subject about the community centers returning for community use after helping out with the COVID-19 response? How many community centers would that be? And then how long would it be before the community can actually use them? Because I understand there has to be some fairly extensive cleaning going on.
Well, the cleaning is underway now, because I think the information, and Marianne could probably confirm this part of it, was that as of, I think, today, all of the people who had been temporarily housed in those community centers have been successfully relocated elsewhere, and then there is a period of time for the cleaning to take place, but we can get back to you and get you the exact date, but I think it's sometime in the very near future. The cleaning will take days, not longer, and those community centers will then be returned to community use. Marianne, did you want to comment on the relocation of the people who were housed in the community centres?
Absolutely. Thank you, Mr. Mayor. So more specifically to your question, we used 7 community centres across the city to support people who were experiencing homelessness at the beginning of the pandemic as sites that were very quickly able to be activated. We started moving people out of the community centres last week when we understood that we were moving into phase 2 and able to run programs for children. So many of the community centres were actually vacated last week and the cleaning began then. The last community centre at Trinity Bellwoods was vacated this week and they also have moved into cleaning. So as far as I know, the registrations for summer camps, the camps are starting as regularly scheduled between July 14th and July 22nd. And all of the people who were using facilities at the community centres have moved to other accommodations, mostly with hotel settings in the community. So we are really pleased to be able to make sure that we are replacing that capacity and also returning those programs to the community for use for local children.
Thank you, Marianne. We'll go next to Christina Tenalia from CP24. Christina?
Hi, Brad. Thank you. Hi, Mayor. Hi, Dr. de Villa. Mayor, just wondering, when you were asked about Toronto being an NHL hub city, you said if that is indeed the case, you were delighted. But it sounded almost like a confirmation from you, even though the NHL and the NHLPA, as far as I'm aware, have not confirmed. Can you confirm that Toronto has been selected as a hub city?
No, the reason I qualified my answer, Christina, was because the journalist, if you go back and listen to the question that was asked of me, said it had been confirmed that Toronto was a hub city. And I said I hadn't been informed of that as yet. Now, it was possible that could have happened between the time I went from my office to here, but I had not been informed of that. And the information I had as of the moment I left my office, because obviously we thought the question might come up, was that there were still discussions ongoing. We've put our best foot forward. We've had fantastic cooperation between MLSE and the 3 governments, including Toronto Public Health, and that we're awaiting confirmation of that. So when I left my office, it wasn't confirmed, but the journalist said to me that it had been confirmed, and I simply went off that question and said, well, if it has been confirmed, I'm very happy about that, as I would be, and I will be. I'm optimistic that we will get the nod, but it had not been brought officially to my attention before I came up to speak with the media.
Okay, thank you. Just to clarify, also want to ask you about the Blue Jays. Do you have any indication that any players are making their way to Toronto today? If you could speak to that. Also, if you could speak to this, because I've been hearing this a lot about, whether it's the NHL hub city in Toronto or the Jays. And someone tweeted this. This is what one tweeter says: how is playing baseball in an empty stadium in Toronto an essential service? Disappointed in all levels of government for allowing this to happen.
Well, it's a judgment call, and I guess, if you want to be critical, you can be critical of all 3 governments who have worked extremely closely together on this, and with a particular accommodation as well, in our case, to public health, to try to see if there are going to be these sports spectacles taking place that are going to be of great interest to a lot of people in Toronto and beyond, that they can take place in our city. The Toronto Blue Jays were in a position, they informed me, where absent the kind of cooperation we've seen from the other governments, they would have been the only team in Major League Baseball not to play in its own city. And I think it is going to be a positive for the city, for the Blue Jays, of course, but I think also for the people of the city. I think right now, even though things are opening up a bit and the summer weather is here, people are yearning for some positive things to be going on. And while one might argue because those games will all be on television without spectators present, what difference does it make when they're playing? I even feel good about the fact that I think the hockey might come here, that the Blue Jays might well come here, and I will just say to you that in the last couple of hours, because I've been in regular contact with the Toronto Blue Jays, a lot of the things that might have stood in the way of their coming here for their training camp have been dealt with, and so I'm very optimistic they will come here. And I think that's good for the city, and if people want to be critical of that, then so be it. I think the one thing about it is that you're going to have people that are subject to what I know is a very strict regime as to how they interact with each other, how they don't interact with the rest of the city, how they're held in a virtual bubble with respect to where they can be when they're in Toronto, and that will really well protect the other citizens and the players from COVID-19. And I think in the case of other businesses not yet declared non-essential, there hasn't been able to be that assurance that has been able to be provided. But I will just tell you that for my part, I am pressing every day with the other governments to work to make sure, as they are, we're all committed to getting as many businesses reopened as quickly as possible within the context of public health.
Okay, thank you. Next, we go to Liz Braun from the Toronto Sun. Liz, go ahead, please.
Mayor Tory, I have a question about the $100 million raised with the bond issue. That's a remarkable story. Is all of that money going to the George Street development? And also, could you elaborate a little bit? What's going in there on George Street? Permanent housing?
What is going in on George Street is going to be at long last, and this is something that has been dreamt about by people in the city government for many, many years, is essentially a replacement for the old and completely inadequate Seton House, among other facilities. And what you will have there is a new men's shelter. You will have specific supportive housing programs going on there to help people with different issues in their lives, and something that I think is going to be a remarkably pioneering venture. You're going to have some floors of long-term care, because the fact is that there are people who are elderly, who are homeless, and who will not end up getting successfully housed at that age. They're in need of some degree of extra care because of their age and because of other issues they may face in their lives. And so there's going to be long-term care built in there. It's going to be a historic facility in terms of what it represents for a new era of care. It is going to cost in excess of $500 million. And I think it is something Toronto is going to be very proud of. And so the first $100 million of that, first portion of that investment out of the $100 million will be from the social bond, in addition to some money for some new homeless shelter beds that are already in the plans that the city has going forward.
Thank you very much.
Okay, thank you, Liz. We'll go next to Jeff Gray from the Globe and Mail. Jeff, go ahead, please.
Thanks, Brad. I just want to ask the mayor about the Premier's comments today that the federal government's insistence on parameters, guidelines, I guess the list of things it wants this $14 billion it's offered to be spent on, that's holding up an agreement that would allow the money to flow, an agreement with the provinces. He said his comments today were just cut us a check and let us figure out how to spend the money. What do you make of that?
Well, first of all, I want to acknowledge that Premier Ford in particular has been a very helpful agent on behalf of cities in Ontario, and I think cities across Canada, by trying to bring together the provinces and the federal government in what has been a very difficult political discussion between them as to who should bear responsibility for what. I certainly would be a supporter of a simple notion of a package for municipalities alone that totaled the amount that the Federation of Canadian Municipalities carefully asked for, which was between $10 and $15 billion to cover the lost revenue we've experienced on transit and other areas, and some of the extraordinary costs we've been put to during the pandemic. But it has been tied up in a series of other seemingly unrelated discussions, or partially related discussions, which I think has complicated it to some extent. But I will say this: the federal government put an offer on the table. I described it at the time as a first offer, not enough by itself, but now I guess we're waiting for those two governments to get together and decide on something they can do together. And I gather that's the gist of the discussions they're having now, which is what can they do together and how does it divide down in terms of who pays what. I wish those discussions would get over with as soon as possible, because the situation facing cities and towns across Canada is very urgent. And we are soon going to have to make discussions. In fact, I think we'll have a report forthcoming before too long that starts to spell out exactly what cuts we're going to have to make, or what tax increases we would have to consider in order to deal with this, because it is not a made-up situation. It is not a fabrication. It is actual, real money we are losing every single day this goes on. And so I would say to both governments, you should both go in a room. I don't care if it's only the government of Ontario and the government of Canada, and forget the other provinces for now, and sit down and decide how much are you going to give to municipalities, putting all other good causes aside. How much are you going to give to municipalities in Ontario? How are you going to divide it up? And then let's get on with actually solving these problems. That's what I think we should all be doing to work together on this. And Premier Ford's been helpful, but there is no agreement as yet from anybody.
And just to follow up on that question of money, you mentioned already you were encouraged by the $150 million announced today for the province for homeless shelters and that kind of a thing. Isn't that number, though, a drop in the bucket of what even just the city of Toronto needs, not just looking at dealing with the response to the pandemic with all the hotel rooms and everything else, but looking ahead to expand that program, to avoid the result of putting homeless people back into crowded shelters once this thing is over, if it's ever over? Don't you actually need orders of magnitude more money to deal with this problem than whatever you get of that $150 million?
Well, first of all, you make the point. The $150 million is not all for Toronto. We'll be trying to get, our share, given that we bear an incredible responsibility for homelessness here, because we bear that responsibility, I believe, on behalf of the region. Many people come here because they know we provide supports here that are not offered elsewhere, and I think but the $150 million is not all ours. And secondly, I made the argument myself today. First of all, it would be much better in terms of an amount that would actually help us to get a better head start on making better arrangements for the future if we had the federal government agreeing to match that sum of money. But even that number would be just shy of what we will have ended up, I think, investing in homelessness and care for those vulnerable populations during the pandemic, just the City of Toronto alone. So you're right, it's not enough. But when we get these things to come forward, I welcome them, because they're all, as Ms. Bedard said, they are all a contribution to making things better for us, because we simply cannot, nor should we have to, make all of these arrangements and provide for all these arrangements on the backs of property taxpayers alone. Property taxes were never meant to pay for extraordinary relief in a pandemic like this, or for that matter, for social programs. And so that's why we've been asking for this help from the other two governments, and that's why they should sit down in a room, with or without us. They should sit down with each other, sort this out, give themselves a deadline, and say, here is what we're going to do for housing and homelessness and a host of other areas to help municipalities who, through no fault of their own, have fallen billions, in our case, billions short of what they need to provide basic services people have relied on during this pandemic. It's gone on too long. It's time for a solution to be found. It's time for them to sit down and come to an agreement. I'm willing to sort of go to such a meeting if I can help. Nobody likes the Mayor of Toronto, but I'm happy to go and help if I can, between two people who I respect, and get it sorted out between Prime Minister Trudeau and Premier Ford. They're the two that can call this to an end very quickly and have an initiative announced forthwith that will help the cities, not just in Ontario, but across this country.
Okay, thank you. We go next to Lance Hornby from the Toronto Sun. Lance, go ahead, please.
Thank you for the Mayor or Dr. de Villa. Although it has not been confirmed yet, could you give us some idea the vital questions that the NHL had for you, and what you might have had for them as far as getting close to finalizing Toronto as a hub city?
So perhaps I can speak to some of the public health concerns. And really the issue was, as the Mayor indicated, what would be the processes by which to ensure that the players stay within the context of a bubble for their own protection and for the protection of the rest of the city. So ensuring that there were appropriate protocols in place, that all good measures, both for the sake of the members of the NHL team and the players and the staff associated with those teams, are all taken care of, and at the same time ensuring that the residents, the citizens of Toronto, are also appropriately protected. So that was certainly the extent of our involvement as local public health, ensuring that really the public health is well looked after, and that the residents of Toronto, that's our primary concern. The residents of Toronto and their health concerns are well looked after based on what the proposal was. I'm sure there were other considerations that perhaps the Mayor might be able to speak to on a broader basis, but from a public health perspective, that's what we looked at.
If I can just say that I was very impressed. I didn't pass any judgment on it because I wouldn't know how, and that's why we have a medical officer of health. They had incredibly detailed disinfection and health protection measures that were in place even within the bubble to make sure that they covered every angle they possibly could from the standpoint of making sure they met our public health objectives. At least it would appear that way from what I saw. The kinds of questions that were dealt with in addition to the public health questions, which of course were the most important, included some of the complications at the border, which were not our responsibility, but we spoke with the federal government, who were amazingly helpful in terms of trying to make an arrangement that respected the reason why the border has restrictions placed on it, but at the same time didn't stand in the way of this. And the other kinds of questions that came were, how do you define the bubble? Because there were, concerns that were understood completely, that when you bring a number of teams and a number of these players in and say, well, when they're not playing, they're going to be in, say, a given hotel. What if they want to go outside for a walk or just have some fresh air? So there had to be considerations of that kind of thing that we really just had to answer questions as to, what we could do to help facilitate that. And as Dr. de Villa said, we gave answers to those questions, and we gave them always with the thought in mind that what we wanted to do was to try and make sure we put our best foot forward to try and be named a hub city, results to be determined, but at the same time did not adversely impact on the interests of the general public, who we are here to serve, who themselves need access to fresh air and open spaces and other things. So we were trying to find that balancing act between winning the hub status for Toronto, but at the same time not doing anything that either compromised public health or interfered with the legitimate needs of the people of the City of Toronto.
Thank you both.
That's it, Lance?
Yes, thank you.
Okay, thank you very much, everybody. That concludes today's briefing. We'll be back here this Monday, July 6th at 3:45 p.m. Thank you.